Good morning, everyone, and welcome to this Kaizen Synergy Law Firm COVIDSafe Legal Compliance session. My name is Nihal Samara. I'm the General Counsel and Legal Director here at Kaizen Synergy Law Firm, and I'd like to welcome you all to today's session. Today's session is part 2 of 3 of the sessions that we are running. We are running another session next week as well too, specifically to support community service organisations and charities that are working right around the country. Last week's session focused specifically on some of the, I'll call it the theoretical side of the laws, and we'll, if we have time, we'll run through some of those background areas as well too. But this really builds on where agencies like yourselves need to head and some of the core considerations that agencies really need to follow. I will add that today's session is a bit of a hands-on session. So what I mean by that is we're actually going to show you what is working for agencies. It's very easy to talk about the problems and issues and challenges, but not really give community service agencies like yourselves solutions on what other agencies like yourselves have actually done. So today's session is that we're going to cover some of these areas off and some of the key things that you really should be considering, especially for your agency's point of view. We're going to unpack service agreements, staffing contract clauses. We're going to look at certainly parts of the services that we are running as part of this whole process as well too. So with it, we are going to run through and actually show you what agencies are running as well too. As always, we'd like to pay our respects to the elders past and present upon the lands on which we all meet. While this session is being run by webinar and recorded, we do pay our respects to the traditional owners accordingly. Just to put a bit of context around this session, like I said last week as well too, is going to cover what the law actually is. It is going to cover what agencies should be considering as part of the roadmaps and what you need or what you should really be focusing on and looking at. This session is not going to cover things like and be drawn into whether anti-vax protests are legal in response to other news headlines that we do see around this and the likes. So essentially, I just wanted to put that into context around this. What we are going to be covering today, though, is around the COVID-safe roadmaps. We are going to be looking at what the rules are, as well as providing an overview of some of the key documents that we are looking at and what we have started to recommend to agencies to look at. And this does include part of your COVID-safe plan as well too. With it, I will just pause this webinar because a few people are asking questions around the sound. I know a lot of people can hear it. You just need to adjust your sound on your computer. I will just add this in around this. Give us 1 second. I am being supported by Ruby and Lynette as well too. And with it, for those that cannot hear us, please adjust this on your computer. All right, and I'll just send that to Paul. Great. Okay, so let's jump in and have a look at what we are looking at today. So with it, what I did want to just mention is that we have been running these webinars since February last year. I will add that these sessions are specifically focused to support community service organizations. And that being said, it is critically important that yourselves be across some of the key compliance obligations that you do need to meet. And it is important that you be aware of what your obligations are. That said, we do have a number of resources that are available to you. These have been made available on our YouTube channel as well too, and you can access access these at any time as well. We do hope that out of today's session, you will get a better understanding of the COVID rules. You will get information on the copies of all of the resources that we are using today, including these slides and also the recording as well too. This webinar is being recorded, as I've mentioned, all the way up to the question and answer part of the session. You can ask questions in the chat group as we go through. You can certainly see that within it, you are able to view these on our YouTube channel, for example. And if I bring that up for 1 minute, here it is here. You can see that we've got it all listed on our website as well too. And for those of you that want to watch previous webinars as well too, and the resources that are available, again, you can actually view those directly here. And we've been running these sessions, as I've mentioned, since February last year. Now, that said, with it, if you do have any questions after today's session, by all means, please reach out back to us. You can do that directly using our email accounts, using our email channels, should I say, our 1300 360 360 number, or my mobile has been made available since February last year and is also, if you search for me, it is also available on Google now as well too. So let's put this into context around the roadmaps. We're going to be covering the states, different states around this as well too. We're going to be looking at key deliverables. We're going to be looking at policy discussions that agencies are having. We're going to give you some tools to actually start using today on this as well. So put it into context of some of the services that our law firm actually delivers, which I did want to just make sure that you're across. So with it, our service, our law firm actually does provide support to medical services, health services, community support agencies like yourselves. Over the last 12 months, we've been involved in setting up COVID testing sites around the country, vaccination clinics, pop-up vaccination clinics, also looking at legal agreements between agencies throughout the lockdown periods, and other things, including even mandatory reporting back to departments of health, and also working with agencies on media release as well. So essentially, when we look at this, and the question is coming that people have asked, how does this relate to charities? Well, essentially, when you start looking at the context of how charities are working in and the space that you're working in, there is issues and government mandates being issued for mandatory vaccinations covering teachers, childcare workers, hospitality patrons, and the likes. And this does cut across a range of services that charities provide, specifically in aged care, disability, health services, and the like. Religious groups are also asking questions on, well, how many people can we actually have within our services? Health services like PHNs and community health services are also asking questions around, well, what sort of service agreements and clauses do we need to have? What about volunteers? Are they covered by this? So there's a range of challenges that community service and charities are actually facing. We are placing all of this information into our Gemba dashboard, which many of you already use. I'll be showing you some of the tools that agencies are using to support the work that charities do and how this can be actually used to keep your staff, volunteers, and contractors safe, and also manage a range of resources as well too. We will come back to this slide as well too shortly, specifically around things like your daily assessment forms and a range of other tools that you will have access to. If you do have any questions, I'm just going to pause this for 1 minute because we are actually having a large number of people just jumping in around this. And I'm just going to send a message to everyone around this. Okay, here we go. So with this, one of the challenges that a lot of charities and not-for-profit agencies ask us on is there just seems to be a lot of information out there. How do we join the dots between things like service agreements for suppliers around pandemic clauses and lockdowns? How do we manage our mandatory reporting to government departments? What about staff contracts? Does that include new staff? What about mandatory vaccination policies? Should we have one? What does an example of one actually look like? Well, we're going to cover all of this today for you and get you started so that way you've got a place to start in terms of your services. So essentially coming out of today, and I always like to do this for those of you that have joined our previous webinars, is to look at suggested recommendations coming out of today's session. So what we are going to say is review your COVID-safe workplace policies. We're going to show you what ones are. Look at your policy on vaccinations, but also some of the other legal documents that you need to consider. And we're going to show you some clauses around inserting this in. Again, if you have any questions, you can certainly reach out to us and we can certainly support you in doing that as well too. So with it, let's go. Now, the legal position, and I just want to cover a few things off here. We're going to look at some of the competing legislation, competing laws that address some of the challenges that you will face. Last week, we covered off some of the legal theories around this. We're going to be looking at the roadmaps again for your specific state and area. But one of the challenges that we're going to look at is addressing some of the regulatory requirements. And this is an example of one. Firstly, while people talk of COVID vaccines, one of the overarching complex legal issues is around the human rights component of this. And it is around this idea of my body, my choice. So essentially what happens is that when you have legislation being made by Parliament, as well as directives being provided by the Chief Medical Officer, there are challenges that people then face fundamentally from a human rights point of view as well. And whether that's around masks or vaccinations, again, these are challenges that people are actually looking at and trying to grapple with and get some sense on, well, what are our legal obligations around all of this as well too. So essentially, just to cover off, there are some conditions that are protected characteristics for medical, whether you're pregnant, or for religious beliefs that may, I'm going to say, need to be considered as part of any policy or COVID-safe services that you also deliver within your agency as well. And these are some of the things that you will need to consider as well too. And we're going to come to those. Now, when we do look at the roadmaps, this is Victoria's one. We're going to look at the other states and territories and take a few parts of this apart. Essentially, when we look at the different roadmaps, there are key things that come out of this. Essentially, it is being driven by what they're viewing as a population vaccination number, whether that's at 80%, 70%, where it opens, how it opens, what is available to your agency. And essentially, agencies are getting confused on, well, what does this actually mean for us? Okay, so if we look at, for example, in Victoria here, the national plan under this is saying phase A, okay, Victorians can get outside to catch up with friends and do some outdoor activities. We've gone with that. Now, essentially, this is what they're talking about from here. What does that actually mean for agencies, and how do you, in fact, map this out when you are looking at this? Same thing if we look at when we go into New South Wales. New South Wales talks about reopening starts at 70% of full vaccination. How do we then look at this? What are the key parts of this that you need to look at in order to, as this roadmap unpacks as well too? And what are the key timelines that you need to be aware of? The same thing goes for Queensland as well too. So essentially what we've placed in here is key action events that your agency needs to look at. And when we talk of action events, this is essentially when we look at Well, reviewing your policy positions around vaccination, reviewing your service agreements, reviewing your contracts on key clauses that you need to see within this. But essentially, there are some things that you need to look at in terms of screening of your staff, your volunteers, and your contractors to ensure that your services that you deliver are in fact safe and effective. Now, when we look at even WA, the same thing applies. They've got a slightly different structure in their roadmaps, but we're seeing the same parts of the different states saying the same thing around, well, what are our things like capacity limits? What are our check-ins that we need to see? What are the restrictions for visiting aged care services and the likes? What are the border controls? So each state has quite similar rules in terms of structures, but the rules that actually apply are different around those as well. Now, essentially what we have seen around this is a set of legal documents and workflows that agencies really need to carefully consider. What we mean by this is that essentially agencies are saying, look, we need to ensure that our staff, community, and volunteers are kept safe. One of the ways that you can do that is using COVID assessment forms. Whether the people are actually having the vaccine or not, essentially this is one of the tools that you can use. The other parts around this is people are still having to work from home, and there are work health and safety requirements that your agency also needs to meet in terms of ensuring that staff are safe when they're working from home, and that may even include tag and testing their homes in terms of meeting your health and safety requirements. There are also risk registers, and picking up what people have asked for in terms of the not-for-profit space, actually looking at, well, what are the key risk ratings and risk assessments that we need to look at from a safe work point of view? And then looking at things like COVIDSafe vaccination registers. Now, we are going to spend some time and go through this. What overhangs each of these areas is some of the legal documents that your agency really needs to consider. Now, when we do look at roadmaps, one of the first areas that we need to look at is your service agreements that you have with other agencies. And we're just going to start a little bit broader. Then we're going to unpack some of the contract staff employment contracts as well too, what some of the clauses you need to look at, and also what should be inserted. Now, this is what we're going to look at here is also the mandatory policy documents as well too, which we're going to look at after this as well. So there are three sets of legal documents that we really say to agencies, look, as you're moving down the roadmap, have a look at what is actually being engaged by your agency from a service delivery point of view. So some of the service agreements that you might have, if you work in food handling, for example, your charity or church might run a cafe, for example, which we've done work for. Then again, you want to make sure that your suppliers are actually managed appropriately as well. Now, one of the two big areas that people have asked us about in the last weeks is around service agreements. One being force majeure events, and I'll talk to you about what that actually is, and also what your insurance requirements should be if one of your providers or suppliers fails to deliver services because they're in lockdown. Now, what we've done here is to look at adjusting people's service contracts, not changing it completely, not starting it from scratch, but essentially changing and updating their what we call force majeure, or what we've called pandemic clauses. So force majeure is things like, it's usually a clause that no one really paid attention to until February last year, until COVID came around. So what we've now seen is that we've actually always had these clauses in our contracts, but essentially what it does is say to your agency and also the service provider that's delivering services to your agency, what happens if there's an earthquake, an act of God, lightning strikes, work stoppage, union breaks, accidents, and now, of course, pandemic lockdowns and interruptions. So essentially, it's an interruption clause. So what we've actually put in here, and this is for an essential service agency, and it's a sample of one. we've essentially said to agencies, look at your clauses here as these roadmaps are being done. If you're doing this a few months later, it's actually going to be too late, because what we're finding is that governments around the country are having rolling lockdowns. So if another agency, your supply, is stopped from doing work, how is that actually going to affect you? And also looking at asking them to look at insurance coverage. So essentially, if an agency's supplier stops you from doing work, well, what is your ability to recourse that and actually get some support around this, or does their insurance actually cover it as well? So we've actually started to put these what we call supply chain clauses into service agreements. It's a small but incredibly important chain of what you need to actually look at within your service contract. The same thing then goes for things like your staffing contracts, and this is a big one. Now, the staffing contract is a whole, I'm going to say a whole nother, we could run a legal session on just alone. But essentially what you also need to look at is your current staff contracts and your future staff contracts. And this is going to lead into my next slide, which talks about mandatory vaccination policies. And I'll actually show you a sample of one that we're actually using for agencies, and this has been shared across with other charities as well too, and not-for-profit agencies. So when we talk of staff contracts, this is where people really start to get interested in, well, or do we need to look at these individually? Now, essentially, we've divided these into two separate arrangements: current and future staff contracts. Now, current contracts essentially mean for all the personnel that you have on deck at the moment. We've summarized some of these items that you should be looking at within your staff contracts down to 1, 2, 3, 4, 5 dot points here. Essentially, what we're looking at is, and we approach it within the community services space as not a top-down approach. This should be something that is worked together with existing staff on. The idea of this is to make sure that staff are supported. I will actually just jump into the question panel, because I do see that Astrid has actually asked a question, which is great, which is very relevant to this. Will staff contracts be updated to also include volunteer agreements? Yes, that is Astrid as well too. So you can take some of what I'm saying here and actually place these directly into policy documents as well. So with it, essentially what we're looking at here is looking at it from a work health and safety point of view. When working, most of the charities I've spoken with, and there's literally thousands in the last year, it is about protecting the workforce, especially in community service organisations like yourselves. This is about ensuring that your staff or personnel are kept safe, including your volunteers. So essentially, what information do you need for them to actually provide to you, and how do you actually keep that information? So essentially, what happens if, for example, if they do have a pre-existing health issue? Most of you, I'd be surprised, should have some sort of screening that you do have already in place. This can now include things like vaccination status and or the reasons why. Again, why we've actually flagged this in is to ensure that if a staff member isn't vaccinated, it might be, as I mentioned early on, for either religious beliefs, medical conditions, or because they are pregnant, or they have some other protected characteristic. If that's the case, then in order to support that staff member, we do need to actually ask them these quite specific questions. It also may be that you want to ensure that information is provided to them. And in things like, if there is a pandemic outbreak, how are you actually going to deal with things like staff leave? If they do have COVID, are you going to run down their sick leave as part of this process as well? So these are all types of the questions that should be asked and actually inserted into some of your staffing contracts as well. Now, in terms of future contracts, it's slightly different. When you go and visit Fair Work website, which I know many of you have, they'll say the same information here as well too, but they actually go one step further and actually direct that news contracts can actually include the vaccination status for a person, and that actually includes even as a pre-employment screening question as well. Elizabeth has just asked, would you consider volunteers in the same light as paid staff? Now, when I say that, Elizabeth, what we are and what we have recommended to agencies is that, especially in the community services sector, volunteers actually play a very, very important role. And in some, if not many, community service organisations, they've actually got more volunteers than they actually have staff. And those volunteers actually provide services on behalf of your community service agency. So for that reason, even when we look at it from a work health and safety point of view, there is the need to ensure that you're providing a safe environment for both your staff and also your volunteers. So these questions here actually do relate to volunteers, and it is about keeping people safe. Now, one of the parts that I will just jump into on this before going into your mandatory vaccination policy, and I'll have a look at this. You all have access to the logins for our Gemba dashboard as a resource for yourselves to look at. And this allows you to, for those of you that are joining us for the first time, a single seat to essentially use the resources and access this. Obviously, if there is being rolled out to your entire community service organisation, there are licensing fees around this. But essentially what this gives you is access to some of the basic tools that we're talking about today. And it is a demo site for you to essentially use. Each of you will get your own login to this as well. So when you log in via the blue button that I've just shown you here, you'll be able to access a range of some of these resources around this to see how they work for your agency. As I mentioned, there is no cost around this to access the demo versions of this. If you do want to roll this out to your agency, which a lot of agencies, we've rolled this out to some 4,000 agencies in the last 12 months alone, then essentially we can do that, and there is a small subscription fee that covers this. Now, one of the things that, and Chris has just asked, how do you get the login details? We'll actually be sending you the login details, Chris, and everyone else straight after this webinar for you to actually access. So, and it will also include the Gemba360.com link, which will take you to this screen here. Now, one of the key tools that agencies have used, and I mean key tools around this, is the COVID daily assessment form. This by miles has been one of the most used forms in the last 12 months. What this does is this: when you click on it and have a look, essentially, in order to keep your staff and volunteers safe, even if they've had the vaccine or not, essentially what this asks is a screening tool that says gives the date and the name of the person that's actually completing it. And what it happens here is that if ask them the questions, have they been in close contact, if they've visited any of the sites, but most importantly, do they have any COVID symptoms? And it's a quick check tool. It's web-based, so a lot of agencies will give their staff and volunteers access via their mobile phone. And what it gives you is the ability to very quickly screen people to see if they've got any COVID symptoms. Now, where this works, and let me be quite open around this, which this other agency has given us permission to talk about this, Rumballara Aboriginal Cooperative down in Shepparton essentially has some 300 odd staff. They've used this form since February and now has listed some 40,000 entries since February last year. What it meant was that very, very quickly, they are able to screen people before they start work. It literally takes people only a few seconds to actually do. And once if they tick yes, it automatically flags out a notification by email to their line manager to say, hey, look, this person is a potential risk. And the agency can jump on it very, very quickly. Another agency which I will shout out to is the Southern Migrant Resource Centre, as well too, from a different service group. They provide much needed support to migrants and refugees that are coming out to Australia. Again, their outreach workers have actually used this tool as well too. And essentially what it does very quickly is notify managers about whether anyone's got the symptoms. But essentially from a work health and safety point of view, what we've done very quickly is be able to screen your staff in a matter of seconds before they've even stepped into your agency. So with it, essentially you can then go back and make sure if there's any work cover issues or challenges of when people have actually logged in, and yes, they're actually COVID safe to deliver the services to your agency. And essentially by doing this, you're actually ticking these parts off even before you've updated any contract around for future or existing staff. Now, one of the big documents that agencies have been looking at is around whether to have a mandatory COVID-19 vaccination policy. With this, and I will just jump back, Michelle has just asked, would you need each staff member's consent prior to asking them to complete this form? Would this be considered private sensitive information? Great question, Michelle. Let me just go back to it as well. So essentially, Michelle, what we have here, and it's just something I should have mentioned, my apologies for this, is that this is based on your organizational structure. So essentially, if staff, it's not a free-for-all where staff can see other staff's information around this. Essentially, what you will see is, and you can set the permission levels yourselves around this. So that way, based on who the staff report to, will be who actually sees it. So if you are a single manager and you have 5 staff that report to you, then you can go to all forms and actually see those staff members. But when I log in or another staff completes it, they can only see their forms. So it's, let's say you have an HR person, HR can manage it, for example, or a single manager can view it only, which makes it a lot simpler to actually manage for your agency. All of this information is owned by your agency. It's not by us, and that's part of our terms and conditions that we have when we set these up for agencies. It is owned by your agency, and your agency is the only one that can access this. So we've got a couple of thousand people joining us today from around the country. Basically, there are separate logins for all of you that can access this as well too. Also, Sandra's just asked, could you use a screening tool for clients visiting your premises as well too? Great question, Sandra. And this form again too can also be used for clients. So we've got agencies that you can actually connect to your own Gemba dashboard via your mobile device as well too, and you can send people that link as well, which means that you have a single point of reference for staff, volunteers, and clients that might access your services. We've actually done this for a number of churches, Sandra, where essentially religious groups are actually having their congregation essentially completing the COVID daily assessment form. It's a smaller form, but essentially they have this information at hand prior to actually doing it as well too, which makes it just so much simpler for them to actually manage it. Now, going on to the sample, the mandatory vaccination policy, and I have this as a Word document for yourselves to look at. With it, this has been one of the most, I'll say, contentious and discussive points for agencies. Now, we have taken a slightly different approach when we talk of a mandatory COVID-19 policy. When we talk of, people have approached this, and for those of you that have seen us, joined us from last week, you will see this slide, which basically, and I will show you a sample of the policy document as well, which I can see a few people are asking questions around. So essentially, we started with a checklist from last week, looking at all the legal obligations of what should be in a mandatory policy, how should it be structured, what should you actually look for in whether having a mandatory vaccination policy. And mandatory vaccination being it is mandatory for people to actually have as part of your employment or volunteer services. We've changed the policy around slightly, where what we have said is have a position on it, but allow for exemptions for and within your agency. So this gives you the ability to actually change it. Now, remember I said at the start of the roadmap when we went back, and I'll just go back to one of them here. So for example, when I said right at the start, we had, for example, Queensland's, and there were specific stages and action lists. Same thing if we look at Victoria, there are specific stages and there are action arrows. So when I speak about reviewing these policies, it's actually at those action stages that I'm talking about. Now, what does this actually look like? Well, essentially, mandatory vaccinations and whether your agency should have it, what I've actually said is have a COVID vaccination policy. This means that it doesn't have to be mandatory for staff to do if your agency doesn't fall into one of the categories, for example, for medical or aged care services or quarantine hotels, for example, but you have a policy on whether people should have the vaccine. Now, what does that actually look like? So essentially, when we look at this, identifying what the purpose is, so what the scope is, and what the background of this is. So these are generally the three starts of what we actually look at. Now, from a policy point of view, let me just bring this up for you, and I'm just going to slide this in to the screen here. Here it is. So we're going to send this out to you. It's a Word document that yourselves can actually use, okay? So it'll get you started on what you have, and it covers all of the core discussion points that agencies have raised on, and it builds off our legal documents that we've also, or legal theoretical parts that we spoke of last week. So part of this is around whether to have it. It'll include, and just to jump across, it'll include things like what is the vaccination requirements? Is there a cost to people to actually have it? What about contradictions in information? Who are non-exempt employees if you decide to go down a vaccination policy? What is your COVID infection procedures? So, for example, if a staff member decides to not have the vaccine, what is your infection control procedures to protect that person within the workplace itself? And we've just given you some areas to actually unpack for yourselves. You might also ask for proof of vaccination. And if you remember last week, we looked at, well, when is the circumstances that you can do this as well? Sandra has just asked, what happens if you implement the mandatory policy and then the person suffers from vaccine damage? Are you liable in any way? Great question, Sandra. So part of what we've done is actually include in here also specific exemptions, and also asking people to say it is under medical assessment that they should be having as part of this policy position. So we're not saying to actually you must do it and there's no other grounds. Essentially, part of this is to ensure that they do have a health assessment that they should be having. As I mentioned, look, it's we're actually one of the law firms that actually set up, as I mentioned, both the COVID testing clinics and also the vaccination services. We're actually working with agencies that are rolling out vaccination buses as well too. And part of what I'll call, without getting into it because it's a whole nother webinar, the clinical governance, what they call clinical governance assessments that practitioners should be following is around clients consenting to having the vaccine. And there's a checklist that I know we've certainly advised agencies to use when delivering the vaccine. So I'm talking of this not from just your agency point of view, but also what people should be made aware of. So with it, we've actually put that into here as well too, to say, look, we assume that obviously before having the vaccine, that you will also be under the medical practitioner or staff member that's actually delivering the vaccine at the health service that they're going to, will actually do a health assessment around this. So that does put it at arm's distance, Sandra, from your community service agency itself. Now, on this, if you needed to ask for proof of the vaccine as well as vaccination records as well, and this might include, now let me be quite clear, when we talk of vaccination records, under things like discrimination laws as well too, anti-discrimination laws, people may not be able to have the vaccine for a number of different reasons. And as I've said before, that could be because they're pregnant, for example. They have other medical conditions as well too that contribute to why they can't have it, for religious reasons or the likes. Now, in that circumstance, what we've asked in this policy here is to ensure that people actually record why they may not have had this information. And why I say that is sometimes it's not just about actually recording the details of saying, okay, they're not having it, and then what do you as an agency actually do with that information? And this is the part from a legal point of view I've actually raised with a lot of agencies to say it's not just about having a policy document, and this is where I will, and I've quite openly said this to various departments of health, having your roadmaps on for agencies to look at is one part. It's up to, you're forcing on the agencies how they're actually going to manage this information. So parts of this is actually around, if someone decides not to have a vaccine, how do you actually manage this out to say, right, we are actually going to have appropriate steps in place. Now, Kerry, which is great, has just asked another question, which I will jump to. If your organisation is covered by a public health order for mandatory staff vaccination, do you have wording to add to the policy to identify that the mandatory aspect is not the organisation's choice? Great question, Kerry. So with it, yes, absolutely. So let me just jump back to that slide before going into the HR module space. So right at the top, one of the policy positions that I've got cut and pasted here is to say, to establish, and you can insert your own agency's name, policy requiring vaccination against COVID-19 for all employees whose job responsibilities are, and we've inserted this information in here. So you can say who was actually listed in here. What we have put in is the background. So in this case, Atagi, we've just selected as that part, has advised that COVID-19 can cause serious life-threatening conditions. And this is where you can actually place this information in and actually add in around chief medical officers, public health directives. And that's the same thing that you can actually see right at the top into the Word document. And this gives you, it's a Word document that you can actually adjust as part of this process as well too. So with it, once you have this information, what do you actually do? Well, essentially you can click on the HR space and all of your employees and volunteers can be listed in here. It's something that works. We've seen this work. I cannot stress this enough. So where we've seen other agencies use this, community service organizations for volunteers, people can actually add this information directly in. Now, where can you actually do this? Well, essentially under a person's profile, you can actually load in, for example, their vaccination card, if that's the way you decide to go as part of your policy document. Or alternatively, in this case, we've actually said Fred has decided to not have the vaccine as he has a medical letter to provide conditions as required by his medical practitioner. You can see we've got the date and the time when that was lodged. And if we need to edit it, we can do that, but we can also add it in as a document as well too. And importantly, we've got the date and the time when this was actually logged. Now, for your agency, this is some of the key stuff where Work Health and Safety have started trying to take audits. We're seeing around discrimination issues starting to be raised. So part of this is not just around the policy document, but to have a look at the exemptions of why are we actually recording this information and what steps has your agency actually taken to manage this as part of this. So Robin has just asked, the government is saying that vaccinations are not anti-discriminatory. Is this the case? If so, then that can't be a ground for exemption on the part of the charity. So, Robin, with it, what it is that, let me just go back to our document as well too. Let me just go back to our presentation. So essentially what we are seeing, and let me just bring this up, is that, and this is where it starts to unpack, we have also included reference documents that the Commonwealth and state governments are relying on. So when we look at these types of requirements, what we are seeing is that there are certain policy positions that different governments are actually advising agencies around the country. So, for example, in Queensland, Western Australia, we've just listed them here. And from the previous webinar that we've actually had, they're rolling them out to different parts of the sector. So that might be agencies that provide support services to aged care. So for example, the Migrant Resource Centre, the Southern Migrant Resource Centre that I mentioned to you before, they don't actually provide aged care services. However, they support aged care services where their outreach workers actually go and visit people within aged care settings and residential aged care settings. So for that reason, they're actually having people, and they've got a policy in place around this already. But what they have done, and let me be quite clear about this, what they have done is actually get people to do the COVID daily assessment form to make sure that their staff and volunteers are actually kept safe, and also the clients are also kept safe as well too. So from a policy position, and let me just go back to this for you. Here we are here. What we have set up for your agencies is a COVID policy template that you can use. This covers off the purpose, the scope, as Kerry has pointed out. You can add in the background. We've listed it as a TAGI, and the reason we've listed it as a TAGI rather than a specific government directive is because the TAGI essentially has set the rules around the directives that a lot of the government agencies are following. But you can add other directives in there. Other parts that we've covered off is vaccination requirements as well, costs of who's going to bear it, your agency's program, who is exempt from it as well too, as well as whether you're going to ask for proof of vaccination essentially from here, and also exemptions from management and who's going to review it. So you've got a real starting point around this, and also picking up, let me just bring this up, Karen's point and Sandra's point. There's also the temporary medical contradictions as well too that people might have, and that's covered within this policy section as well. So it gives you a point to actually manage this process as well, and allow staff to be part of this process. So a couple of things that's come up. I can see questions here, which we will jump back to this to the slides as well too. Tony has just asked, can vaccinated staff refuse to work with unvaccinated staff, and do we legally have to advise vaccinated staff that someone they are working with is unvaccinated? That's a great question around that, Tony, as well. And what we have seen just leading into this as well, and let me bring this up for you as well, you'll find on the slides that we've actually brought up, essentially it's covered here, and we've cut and pasted that back into the policy document. So under fair work, in the event that there's no mandatory direction that's covered by that covers your agency or service area, then essentially what Fair Work have said is that people can't actually refuse to show up to work if another staff member is unvaccinated. And it's actually, we've actually copied these slides directly from Fair Work. So you're right, Tony, essentially what we're seeing here is an overlap, and this is what's causing so many agencies around the country so much confusion. There's an overlap between there's an overlap in requirements between regulators. So what the Fair Work is saying, what Safe Work fair work, safe work, and also privacy commissioners, equal employment discrimination commissioners as well too. Essentially, all these different regulators are having their own rules. And what agencies are trying to work out is how do I then map this back to what government directives are saying. So essentially what we've got here is the set of slides that will actually answer these questions for you as well too, and give you the current state of play at the moment. So essentially, as people are coming up, and if they're asked, can an employee refuse to attend the workplace because a co-worker isn't vaccinated against coronaviruses? Well, in some places it's mandatory and in some places it's not. So it will actually depend on what services your agency actually delivers. With it, one of the areas that we've actually said to agencies, again, and all of these resources will be made available in your gender dashboard as well. Essentially, what you've then got here is the tools to manage this stuff. And we know these works because as hotspots have been rolled out over the last 12 months, agencies caught up in all of this have been able to very easily change their position as well. Michelle has just asked, what if a staff member refuses to disclose their medical information under the Privacy Act, for example? Information cannot be collected unless you have the staff member's consent. Is this correct? So essentially, Michelle, around this, again, this overlaps exactly what I was saying around this. This overlaps directly between the Privacy Commissioner and also Fair Work around this as well too. So where we've actually seen this, and let me just bring this back for you as well too. Essentially what we have seen is you can ask people for evidence of their vaccination status. And you can do that in certain circumstances where that may be allowed. Now, if that's the case, if we approach this from a work health and safety point of view, then essentially you are able to ask people for this information around it, but again, disclosing why or what reason they may have. Now, again, it's around ensuring work health and safety for your staff and also the services that you're delivering to your clients. So there are exceptional circumstances and arguments that can be made around this as well. Astrid has just asked quite openly, though it would be a violation of privacy to inform vaccinated people that others may not be vaccinated, and who are they? We wouldn't go down that far, Astrid, around it as well. Essentially, what we're saying here, this is again covered within your vaccination policy around where and what is the use of this information that you're actually collecting. Equally, for Vanessa's and Astrid's question around this, and I'll also just go back to Vivian's question as well too. Essentially, what we are seeing is putting in what work health and safety talk about is what is reasonable for your agencies in terms of how are you actually providing a safe work environment. As I've mentioned, one of the big things is around the daily assessment forms, because this, if you can actually catch people showing up to work before and identifying whether they have any symptoms, you're actually taking a very significant reasonable step in being able to do that. The other part around this is the working from home form. Now, the working from home form, again, brings in your safe work obligations as well. So again, where are people working from? What is their tools that they're doing? What are the activities that they're doing from home? Do they need any supporting services as well? So again, you've got access to this information that allows people to complete this when they are required to work from home. So essentially, a lot of the tools on here allows you to manage this. Now, one question that has come up is, how do we in fact say that we've actually managed all of these risks? And there are questions that people have asked around mandatory policies, vaccinations, pandemic assessments. What is the process that we have? Now, what you will find on your GEMA dashboard is the risk register. Now, this makes it live very, very simple to actually manage, and also for your agencies where you need to complete things like your annual information statement in terms of what are the services that you've delivered, and that's coming up in November as part of your compliance reporting. So what we've actually looked at here are 3 indicators that are causing community service organisations the biggest risks around. So this is a risk register. This will address your roadmaps. This will address your COVID-safe plans. This will essentially address a lot of your other non-compliance issues. So what we've done here is cover off vaccination for staff, what the rating is and how to manage it and what the document is. Same thing for the staff attestation forms, what the assessment is, how to do it, and how to mitigate your risk. And also things like lockdowns around this as well. So essentially you're able to draw the dots together and you can actually edit this for yourselves and actually view these individual forms within your dashboard. John has just asked if employee states is not vaccinated due to religious reasons, do they need to provide formal proof of religious status? That's a good question, John, around this. Now, under Fair Work, as we stand at the moment as well too, let me bring this up for you as well. Essentially, you can ask people for information on not only their vaccination status, but also reasons for why they may not have had it. What I will add to it though, which is critically important, which we've said to agencies, is document this information down. So if people are coming in and they are asking you for this and you are turning around and saying, well, we need to know why you may not have had this. Again, it crosses over anti-discrimination laws, it cuts across Fair Work. And one of the things that we've said to agencies is quite simply load it in and actually say, staff member has not had the vaccination due to religious grounds, and we have also asked them for supporting evidence. This is also covered up within your policy documents as well too. And again, the idea is that you're doing this to protect also from a work health and safety and also meet your Fair Work obligations. So with it, as I said, this resource tool will allow you to manage your roadmaps around this. We are going to be looking at this a lot more carefully next week as well too, and go through some of the further details that your agencies need to look at. What I will say as part of the recommendations, and more than happy to open up the phone lines around this and question panels when we stop the recording, we are going to be looking at next week around managing staff, volunteer and clients using this dashboard as well too. And we can also unpack other documents and information that your agency might have. We will also, and a few questions have come up, yes, we will be circulating copies of this document as well too, that will also be available for you to access as well, and also give you a starting point around this. If you do have any questions, by all means drop them into the question panel, and if you are watching this recording after today's session, by all means please contact us on 1300 360 360 or reach out to us at support@gemba360.com.